Hi everyone, I'm Vivi, or Dr. Paraskevi Triantafyllopoulou from the Tizard Centre, and I'm here today to talk about best practice for inclusivity for people with learning disabilities in research. And what I'm going to use my one of my own research projects, the Save Online Lives, that is currently ongoing, as an example, just to show you what we've done there and how we manage things, and open to discussions really, and we're still reflecting of how we could have done things differently or better. So a bit of background: the Save Online Lives is looking at internet use for people with learning disabilities, and so obviously, especially now during the pandemic, but also before, and now it continues actually. So people with learning disabilities, they do use the internet a lot. So this access to the internet, it can bring a lot of benefits, a lot of opportunities, but also a lot of risks, but also thinking about the exploitation or harm that can bring on, and the risks of digital exclusion for this population from care providers, carers. So the aims and the idea of this research project was to look at the benefits of the internet use for people with learning disabilities, what opportunities that were offered while they were online, the risks that might come up, and the barriers that they might come across because of that digital divide. And when we first started, what I did, just from the actual realization of the project, when it was long before the pandemic came, so long before, it took me 2 years actually to get that funding. So it was long ago, before the COVID started. So I started having some face-to-face focus groups with MenCap, East Kent MenCap, where I was involving people with learning disabilities and asking them about how they're using the internet, and what the staff members thought. And there was a social worker there as well, but also carers. They didn't go to family carers at the time being, so I think this was, which I think that it would have been even more beneficial. But to begin with, I just wanted to show how, even from the first idea, when I didn't know exactly what I was going to do, I first then did that focus group. So what it became apparent that there's a clear need for the project. So I asked from MenCap, and also I had connections with Dimensions at the time. So I asked them for letters of support, and I asked them to help me put together the project and think through my ideas to see if they were sound. In the Tizard Centre, we're really lucky that we have a group of people with learning disabilities and autistic individuals that is called RAG. That's the Researching Altogether group. This is a group where we have been training, and they're research aware, and they're advising us in research projects. They have been involved in the development of easy read material in the past, and also, there's always a bit of an issue around payment for the RAG group, as people are receiving benefits, and we don't want to interfere with that. So we are paying the RAG group, but giving them like some amount in the year. So if you're interested, or I would really want to have more conversations about that participatory research and how we pay people in order to participate is a real issue for me. So I would really like to have more discussions about that. So the RAG group for this project was involved in the conceptualization of the project, but also on practical things. And I also included a family carer from that same group, actually, to look at that family perspective that I felt that it was missing from that first focus group that I did. So the participants of my project is adults, people with learning disabilities, people that have capacity to consent and they're currently using the internet or they have used the internet in the past. There's also the participants are family carers or paid carers of people with learning disabilities that are using the internet or have used the internet in the past, and safeguarding practitioners. So anyone basically with a safeguarding role, a safeguarding element in their role that they're working with people with learning disabilities that do use the internet. And what we decided to do, we decided to go on and do some questionnaires for adults with learning disabilities, different questionnaires for family carers, paid carers, and safeguarding practitioners. Then we went on and had interviews, one-to-one interviews with 20 adults with learning disabilities. We had 4 focus groups with family carers.
Hang on, I'm in a meeting.
Family carers, paid carers, and safeguarding practitioners. And we also, the last part of it, we were doing some observations. I'll talk a bit more about it, which is with adults with learning disabilities themselves. Now, the RAG group, so the Researching Altogether group, it came in the design of the questionnaires, so looking at the accessibility of the questionnaires, but also looking at the content. And we ended up with 2 different versions, one easy read version with pictures and one easy read without pictures. See, without the involvement of people with learning disabilities there, I wouldn't have thought that pictures would have been problematic for some people because, you know, they might have felt that they're a bit childish, whereas for other people, they would have been okay. So we decided to just be inclusive and include both. So we asked for advice on the wording, on the pictures that we were using, on the content that we were using, but also apart from the questionnaires, we also had the RAG group involved for the information sheets, the consent forms, the accessibility forms. We also, in the observations, we are actually using we're using an app that we are developing. So we were talking to them about the avatars that we were using, the scenarios, and the co-development of the measures. So all the measures that were developed with the RAG group and with an advisory group. So basically, in the whole study, we had 2 different advisory groups. One advisory group with adults with learning disabilities, where we were going through everything with them. And also, we also had a different advisory group of carers and professionals and academics and service providers, but also including people with learning disabilities. So the functions of the 2 different advisory groups, the learning disability advisory group was much more hands-on, but they were also included in the second advisory group where we were looking at the study overall and thinking about the study as a whole and progression. So we also had a Twitter account. So we thought that that was a good way to actually disseminate, but also have easy read versions. This is the tag there to follow us if you would like. And this is where we are posting updates and, you know, getting to know people that they want to participate and spreading the word, really. So we did a lot of tweets, and this is where we were introducing some of our advisory group members like Laurel, Craig, Julie and Alan, and talking about why is it important to be involved in the Researching Altogether group, and why is this project important for you? So here's some information about the posters and the leaflets that we did. As you can see, they were all easy read, and the RAG group and the advisory group, they were all helping us to bring all that in and get more information about how to put things together. And here's a leaflet on the right about the study and when we were trying to get participants. So the survey is now closed for the study, but we are continuing with the observations part. So we also made a website, University of Kent, where we are, which was a challenge to begin with, because you know, putting everything in, the university likes long Word documents or websites with a lot of words. They don't very much like easy read material. So it was a battle actually working with university IT to develop this as an easy read format, and go and have a look. It hasn't been updated recently, but it actually states the core bits about the study. So yeah, please do go and have a look if you like. So moving on, thinking about, so we did the questionnaires, we did the interviews and the focus groups, and now coming up to the observations. And this is where things got a bit, you know, we had to rethink about things. So that's why I've put down there, is it not working? Change it. Don't be afraid to change it. This is research. If we knew about things and how things would work, we wouldn't be doing them. And always go back to people with learning disabilities, actually to advise you of what is working. And when we started to do the think aloud observations for us, the initial plan was for people to sign in their social media, and for us to go through the feed together and discuss the interactions that they were having online, and look also at the privacy settings and think about that. However, when we started doing that with our advisory group in order to get some feedback before we started actually collecting the data. And there were some barriers there that we hadn't thought about. That people were finding it hard to do. People were forgetting their passwords. People were having a bit of access issues regarding the phones, or like they didn't want to, you know, they forgot their chargers, or they couldn't connect to the internet. So we had to take a step back and think through it, and think with people with learning disabilities about how this would work. So what we ended up doing, it was to actually create our own social media, as we had for Twitter, to add some things, some pages on Facebook and Instagram, and ask people to be our friends. So we would be looking at their content via our profile as their friend. So, and going through the feed via our account, but also asking people to look through our privacy settings. So thinking about where would you look up for those. And that worked very well. So we ended up changing some bits, but it really did work. Then the involvement in every step. Next step for us was to actually put together that app that we are currently doing. So that app, and I don't have more information to give you because it's being finalized this week, I think. It's a really exciting time for us. With the app that we are using, we use scripts for more interview data. So these are all true stories that we've put in there. And the way that things are going forward, they're all being checked via our advisory group, and meaning the advisory group with people with learning disabilities. In order to give voice to the avatars that they are taking part in the app, we thought that we could be getting like actors without learning disabilities, but we thought that it would be excellent idea really to employ actors with learning disabilities, so they record the voices, and it was perfect. The result was beautiful. So we went to Square Pegs Art and employed 2 people to actually give their voices to the avatars. And we are now putting everything together. In the end of the study, We are going to involve people with learning disabilities, but also different stakeholders to discuss our findings, because the funder would like us to have an end of project report. So we would like to have everybody's views about what is important to include in those reports. And so we're going to be discussing how the findings should be presented and what should be included there. We will be organising 2 accessible dissemination events, one in Kent and one in London for all participants and different stakeholders. We're going to open it up to everyone to attend. And we would really like to involve our advisory group in the dissemination events. So we would like to either include them live to come and talk to people about the whole process and about the findings. And if we have, because obviously we're going to be going to national conferences or international conferences, we would like to include videos of the advisory group presenting parts of the study if they can't travel with us. So I hope that I've made it on time. Actually,